Our first speaker today is someone that David and I got to know personally on the Pediatrics on Call podcast, Pathways to Pediatrics. It's Dr. Thomas Glenn. His lecture honors Dr. James A. Stockman III, past president and former CEO of the American Academy of Pediatrics. Dr. Thomas Glenn is currently a pediatric cardiology fellow at UCSD Rady Children's Hospital in San Diego. Born with hypoplastic left heart syndrome, he developed an interest in medicine as a young child. As both a patient and provider, he has informed the work of the National Pediatric Cardiology Quality Improvement Collaborative and the Cardiac Neurodevelopmental Outcome Collaborative. He is co-lead of a design work group of the Nascent Fontan Outcomes Network, working to improve long-term outcomes for patients living with Fontan physiology. Let's welcome Dr. Thomas Glenn.
Thank you for that kind introduction. My name is Dr. Thomas Glenn, and I'm going to be speaking about building resiliency, a patient and provider's perspective. I have no financial disclosures. Thank you to the American Academy of Pediatrics and the American Board of Pediatrics for this incredible opportunity and allowing me to speak here today. Thank you to Dr. Carol Lannon, not only for your leadership through all of our work together for patients with single ventricle physiology these past few years, but more importantly, for your incredible friendship and mentorship. It is such an honor to be speaking here today amongst my fellow pediatricians on a topic that is so important to me because it has changed my life. Now, while I wish everybody could be here in San Diego, where I currently reside, I hope that everybody is staying safe during this pandemic, and I encourage everybody to continue being kind to one another. The world needs it now more than ever. To be delivering the James A. Stockman Lectureship on behalf of a man who dedicated his career to improving care for pediatric patients, both in the community and in practice, means a great deal to me. I hope to be able to share some experiences through the lens as both a patient and provider that everybody listening can take with them and employ in their practice to also improve care for their patients. The field of pediatric cardiology is a relatively young one, and it's only within the last century that this field even came to be. Children with complex congenital heart disease, or what many refer to as blue babies, often didn't survive as there were very few options for intervention. In 1944, the first blue baby operation, or the Blalock-Taussig-Thomas shunt, was performed at Johns Hopkins, and since then, the field has continued to expand exponentially. By the mid to late 80s, these surgeries were performed more routinely on newborns that required an early cardiac intervention. My story starts in 1990, just as a 12-hour neonate who started to demonstrate signs of poor perfusion. I was quickly rushed to the University of California, San Francisco, where shortly later, I was diagnosed with hypoplastic left heart syndrome. Now, given what I just mentioned about how young this field was, it comes as no surprise that my parents were given very few options. Either let me die or undergo a series of 3 surgeries, the first of which my surgeon had never had a patient survive and make it to discharge home. The surgeons essentially told my parents I would be lucky to survive, God forbid even make it to a few years of life, and that comfort care was the best option. My parents challenged the medical team and chose to move forward with staged operations. I am now 30 years old, and over 26 years have passed since my last open heart surgery. I have been fortunate enough to live a nearly normal life, and I am now a board-certified pediatrician and currently a second-year pediatric cardiology fellow here in San Diego. I have met many people with various forms of congenital heart disease throughout my life. While we are all connected by the same scar that runs down the center of our chest, one way we all differ is in the way we have chosen to live our life. I have met some patients living with half a heart that are excelling in their lives, doing the things that they love, like snowboarding, attending graduate school, and even getting married and having a family. Now, while this is encouraging, there remains a large proportion of patients living with complex congenital heart disease and with other chronic illnesses that don't quite live their life to the fullest and pursue their dreams. I want patients with chronic illnesses to thrive, not just survive. While I may not have the magic cure or exact answer on what drives certain patients to choose one path over the other, I'm going to share my personal experiences as a way to provide insight on how I become the person I have today. Now, if you were to look up the definition of resiliency, you would likely find different definitions ranging from the ability to recover from difficulties to the ability to cope after a crisis. And while these are accurate definitions, the easiest way I like to think of resiliency is the ability to spring back into shape, just like nylon or a rubber band. To me, resiliency is the ability to bend but not break, to go through the ups and downs that living with a chronic illness often entails. But at the end of the day, you're still here and you're still present. Resiliency has been the most important factor in helping me become the person I am today. I was probably building resiliency without even realizing it as a child, and there were many events in my life that helped me become a resilient individual living with a chronic illness. I think my parents challenging the medical team when I was just a day old was the first time resiliency was actually introduced into my life. This continued as I grew up. When I was about 4 years old, I was being disciplined by my mother for something bad I had done. And my response to her was that my bad heart made me do it. Now, despite how difficult it must have been for my mother to not laugh at the answer, this response didn't fly with her, and I was treated just like any other kid should have been. While it may not have made a big impact on me that many years ago, it was still this teaching and way of living that I grew up with. Many small events or things that happened throughout my life that made me a more resilient individual. And you know what the best part about this is? Some of these events were the result of my medical providers. And I want to share some of those with you because whether you're a general pediatrician or a subspecialist, you too can make a huge difference in the life of a patient. When I was in high school, my medical team changed and I started following with a new cardiologist. It turned out this was the change I needed. When she first entered the room at each visit, she always turned to me first and asked how I was doing. This was the first time a physician or any medical provider had ever really spoken to me first before my parents after entering a room. She dedicated most of the visit to just talking to me as a person, asking how I was doing, rather than just skipping straight to the results of the stress test or the echo. She often asked me what goals I had in life, what I wanted to do in the future, and even encouraged me to attend medical school when I first voiced that interest. I think my parents were initially in shock, as we really have never had a provider push me this hard to live my life normally. But for me, this was huge, and it presented this new feeling of motivation and drive that I still wear on my shoulder to this day. These visits with my new cardiologist affirmed to me that I can live a normal life and I should be pushing myself further and further to accomplish my dreams and live the life I want. Sometimes, questions as simple as, "What are your goals?" can have an incredibly lasting impact on a patient and their families. In many cases, families may be hesitant to allow their child to live a normal life, simply out of fear. But this fear may just be due to the fact that nobody has ever told them that they can let their child live a normal life. These discussions need to occur at a young age, as the effects in turn will be additive as the individual continues to grow up. Now, I want everybody to imagine what it would be like to have an open heart surgery. What emotions and feelings would be going through your mind and your body? Now, imagine that you've had 3 of these operations all before the age of 5. Now add in at least yearly cardiology visits with echoes, EKGs, laboratory tests, and stress tests. Add to that the idea that you're going to need a CT or MRI every 2 to 3 years. Now include the cardiac catheterizations you're going to have to go every 5 years for. And this doesn't even include all the bullying you may have encountered growing up or the loneliness you may have felt from being unable to participate in physical activity and sports like your friends did. Now, on top of this, think about all the living you have to do with the uncertainty and worry of how long you might live or what complication you may have to deal with next. Unfortunately, this is the reality for many patients like myself and for many others around the world living with chronic illnesses. It's no wonder that such a high percentage of these individuals deal with anxiety, depression, and PTSD throughout their life. Mental health issues remain the elephant in the room for individuals living with any chronic illness. Despite all the progress that has been made over the years at getting access to these services, there remains a large stigma surrounding the topic of mental health. Individuals often feel like they'll be deemed crazy if they seek these services out. Others think that they have to do this all alone in order to be considered strong and resilient. In truth, being strong and resilient just means you ask for the help in order to recover. Mental health services need to be rooted into the care plan for any patient with a chronic illness. Ask parents how they're doing. Support the family, as they can only help their child if they're well too. We as pediatricians need to do a better job of asking the right questions and ensuring that all individuals are receiving the services they need and rightly deserve. Now, many of you may feel untrained and perhaps uncomfortable doing this. That's fine. But the American Board of Pediatrics makes it easy for you. Just look up the ABP Roadmap Project for a list of resources and tools so that you don't have to be a mental health professional to make a difference in the emotional health and resilience of this population of patients. As I've alluded to before, there's no way that anybody can go through their life with a chronic illness alone. I realized very early in my young adult life that I needed to build a community of people around me that will help me get through the difficult times and be there to enjoy the good times with. As you'd expect, family members and close friends were essential personnel in the community I built. My medical care team, especially my pediatricians and cardiologists, were important to have in this community, and for my parents too. Perhaps, though, the most important were the individuals I've met along this journey who were also living with single ventricle physiology. I first met others with congenital heart disease when I attended Campdale Corazon, otherwise known as Heart Camp. This camp is located on Catalina Island off the coast of LA and occurs yearly over the Labor Day weekend. Children and teenagers living with various forms of congenital heart disease are invited to attend and take part in a variety of activities that you normally would not be able to do. From archery to rock climbing to kayaking, it was the first time at the age of 10 that I truly felt normal. Normal. It was such a great feeling. I was surrounded by other individuals with the same long mid-sternal scar, all of whom were surely going through similar physical and mental difficulties associated with our diagnoses. Meeting and remaining in contact with people from camp has been one of the most mentally therapeutic things I've ever done. Now, although these camps are available for many different chronic illnesses around the country, I understand they may not be available for everybody. Just suggesting the value of peer-to-peer organizations to families of children with chronic medical conditions is something I encourage you all to do. There are many support groups that exist by which individuals can meet others with their same diagnosis. Through my work with Dr. Lannon and the National Pediatric Cardiology Quality Improvement Collaborative, a group of 4 individuals, all living with single ventricle physiology, myself included, have started a yearly patient day for others with single ventricles age 14 and over. We invite esteemed colleagues in the field to speak about various topics ranging from mental health to exercise to how you can take care and ownership of your cardiac care. But perhaps the most important thing we do at these meetings is that we listen to one another and provide support to one another. These organizations exist for many chronic disease processes, and I encourage all clinicians to be aware of these and refer patients to them, as they can build one's resiliency and really be life-altering. There are now more adults living with congenital cardiac disease in this country than pediatric patients. The need for a strong transition to adult care is absolutely vital, something that I'm sure can be applied to any pediatric subspecialty. This transition of care is one that can be exceptionally difficult for providers, patients, and of course their families. In addition to having to let go from a pediatric provider who you've been seeing for decades in some cases, patients love the comfort and caring demeanor that's often associated with their pediatric care teams. As I'm sure all the general pediatricians and subspecialists can attest to in this room, this transition is one that remains an obstacle in our field. I'll be the first to admit, I too was that 28-year-old laying on the bed, getting an EKG with my legs hanging halfway off the bed. I was probably old enough to be the parent of most of the other children in the waiting room at my cardiology visits. It was only within the move to San Diego the past year and a half that I transitioned to an adult congenital cardiac provider, While this is a transition that certainly needs to happen earlier, there were things that my cardiologist did to prepare me for this transition. By the time I was 14, I was expected to know the names, dosages, and times for my medications. I knew the name of my cardiac lesion and could explain what it actually meant. At some institutions I worked at, the patients were expected to be able to draw their cardiac lesion out on a whiteboard. I believe that the ultimate goal of transitioning care to an adult provider is for the patient to take ownership of their care. If the patient doesn't take ownership of their care, then this transition will not work. For this reason, this transition needs to start years before the actual change in provider occurs. I can promise that if done correctly, patients will feel empowered as they are able to take part in this process and own their chronic illness. This will in turn prepare them for the transition to not only adult medical care, but also to the adult life outside of the home. This process will build resiliency. As I close out this year's Stockman lecture, I want to stress the importance that a pediatrician can make at any stage of their patient's life. Remember that emotional health is an essential aspect, and you can start by simply asking the family how they're doing. You can share that many individuals with chronic conditions and their families feel stressed and overwhelmed, and these feelings are completely normal. Ensure that the family knows the importance of emotional support and that resources are available and often helpful for families and patients living with a chronic illness. Empower your patients. Let them feel like they can make goals and actually accomplish them. Lastly, families and patients will often feel supported by one another, so encourage this peer-to-peer support so that nobody feels like they have to do this alone. These small changes in your everyday practice will help build resiliency, and together we can improve outcomes for our patients. Thank you very much.